Hi, my name is Asmik Cholakian, and this is my presentation on chronic obstructive pulmonary disorder, otherwise known as COPD. What is COPD? COPD is a progressive disease that makes it difficult to breathe. The disease is progressive in the sense that it gradually develops and worsens over time, and it limits an individual's ability to perform daily activities. COPD is an umbrella term used to describe a group of lung disease that block the airflow and increase breathlessness. Currently, there are 16 million people affected by COPD, ranking it as the third leading cause of death in the U.S. As recently mentioned, COPD divides into different forms. Emphysema and chronic bronchitis are the most common conditions that make up COPD. Bronchitis is the inflammation of the bronchioles found in the lungs, and the inflammation results in excess amount of mucus being produced, leading to long-term cough and difficulty breathing. As you can see, the picture provided on the right represents the difference between a healthy bronchiole and a bronchiole with chronic inflammation. Now, the healthy bronchiole is clear and unrestricted, whereas the other one is red, which represents inflammation, and the yellow mucus built up is what restricts the tube and ultimately the airflow. Now, emphysema is the permanent damage of the small sacs of the lungs called alveoli. The alveoli are the site of air exchange, and over time, these sacs weaken and eventually rupture. This creates larger air spaces instead of small ones, and this reduces the surface area of the lungs and subsequently reduces the amount of oxygen that reaches the bloodstream. The picture provided shows the normal alveoli with more small sacs which increase the surface area, allowing for normal air exchange. The alveoli with emphysema shows the walls of the sac are ruptured, creating larger spaces and decreased surface area. Now, it is said that most people with COPD have a combination of both conditions. Now, there are certain risk factors that put certain individuals at a higher risk of having COPD. Some of those risk factors include exposure to tobacco smoke, even secondhand smoke. Now, the more years you smoke and the more packs you smoke, the greater your risk is. Now, statistically speaking, up to 75% of people who have COPD smoke or used to smoke in the past. People with asthma who smoke are also at a higher risk. Long-term exposure to chemical fumes, vapors, and dust within a workspace environment can also irritate and inflame the lungs. Another factor is age, as COPD does develop gradually. Most people are at least 40 years old when symptoms start to appear. In very rare cases, though, non-smokers who lack a protein called alpha-1 antitrypsin can also develop emphysema. Now, some of the symptoms for COPD include but aren't limited to shortness of breath, especially during physical activities, wheezing, chest tightness, excess mucus built up in your lungs resulting in having to clear your throat in the mornings, a chronic cough that may produce mucus that may be clear, white, yellow, or green, frequent respiratory infections, and unintended weight loss, which is more common in the later stages of COPD. Now, there are certain tests that may be conducted in order to diagnose COPD. Some of the tests include lung pulmonary function tests such as the spirometry, which basically measures how much air you can breathe in and out, how fast you can breathe air out, and how well your lungs deliver oxygen to your blood. Other tests include chest X-ray and CT scans, and these tests create pictures of structures inside your chest, heart, lung, blood vessels, etc., and these pictures show signs of COPD. Another test that may be formed is arterial blood gas analysis. This blood test measures the oxygen level in your blood using a sample of blood taken from the artery. Now, unfortunately, damage made to the lungs from COPD is irreversible, and there's no current cure. Therefore, the goal of treatment is to help control the symptoms, slow progression of the disease, improve exercise tolerance, prevent and manage complications, and improve the overall health. We can do this by using inhalers, taking oral steroids, oxygen therapy, pulmonary rehab, and lifestyle changes through smoking cessation, meaning completely quitting tobacco. This concludes my presentation. I hope it was informative and you enjoyed it. Thank you for watching.